welcome to the college and this particular symposium on global surgery in the 21st century.
2 to 5 billion people on this planet don't have access to safe surgery.
I think there's a real need to get better evidence to inform global surgery.
It's essential that grassroots surgeons are doing the research on the patients that they're looking after.
There are immense problems. I don't think they are necessarily primarily surgical.
The only way we know how to do stuff differently is if we start doing trials. Now, this is difficult as well, and some people might say, we shouldn't be doing trials in these situations because there's other things to concentrate on. No, that's just not good enough.
There's a lot of work to do, and I think it'd be fascinating in the discussion to think about the role of a college like this, because I think there is a critical role for various high-income country institutions.
Surgery has to be the smaller part of the totality of care that we can afford to give the people of Africa.
We've given them the tools of the trade to deploy their skills. That means they'll stay because they're doing what they've been trained to do and want to do. They'll not become the African diaspora that populates the rest of the Western world.
We should be devoting our efforts to the preventative side of healthcare and saving many more people than many hospitals concentrating on surgery might.
What we are doing in the Western world is not fit for purpose on the global stage. The kind of surgeon we're producing in the UK is in the main a specialist that needs a lot of kit to do the job. What's needed in the rest of the world is not specialist surgery.
I think we also need to really catalyse a lot of activity at national level. And it's not up to the Commission, or it's not up to high-income countries, it's up to national governments to really take hold of these messages and begin to create effective policy for the country and implement that policy. And that policy is around workforce, it's around finance, it's around service delivery, it's around information. It's very, very broad. And it's not just the surgical community that need to engage, it's a whole lot of other stakeholders that need to engage to really bring change at a national level.
We've just come to the end of an excellent evening, the first global surgery symposium that we've held at the Royal College of Surgeons of Edinburgh. This is an area in which we've had a major interest for some considerable time, but it's the first time we've put together a symposium, and it's been particularly interesting because we've had 4 very diverse speakers. They've been terrific in their presentations because they're going to catalyse our thoughts for the future on how we take this forward.